I'm Christina Delgado. I am a nurse and program manager with Seattle Children's in our external affairs department. And so really glad to be with you all here today to talk about safe and secure firearm storage. Let me just bring up my slides. I think, how much time do we have? I think we talked originally about anywhere from like 1 hour to 2 hours, but I see it's booked out for 2 hours.
Yeah.
So so you all just let me know. We can take breaks as we need them throughout. I also really feel like given the size of the group and given the work that we all do, I encourage folks to just come off mic and provide any feedback that you have to offer. I think you all, especially clinically speaking, have so much robust experience. And I think with something like firearm storage conversations, we have so much to learn from each other. So please know I take a very informal approach to this. I want it to be more conversational. So please include comments on the chat. I think I can see them, or a sign that there's a comment in the chat here, or come off mute and provide any questions or feedback that you have to contribute. I'll start. Actually, I can forge ahead just so you have a sense of what we're going to cover. In general, these trainings have been happening for about a year now. Seattle Children's was one organization supported through the Washington State Department of Commerce, Office of Firearm Safety and Violence Prevention, to provide safe and secure firearm storage, counseling, and devices throughout the state. So I will say that I feel I have learned tremendously over the course of this past year from working with different groups. The training often happens in about an hour for some groups and then an hour and a half for other groups. And we try to cover a lot of information. So I'll give a really brief program overview, and then from there transition into the data picture of firearm injury in Washington State. And then, of course, looking at that data, we then transition with what do we do with this data? So really thinking about our organization and how we have crafted safe and secure firearm storage key messaging rooted in that data. I want to just acknowledge right now that the data we're going to focus on is pediatric in nature. So Seattle Children's really services 0 to 21 years of age. I know that even in working with other groups, including at Madigan and the recent training, folks were saying when we talk about that 18 to 21, even 18 to 24 on some of the slides, we're talking about a lot of our service members. Mm-hmm. So, but I also recognize that a lot of our messaging may miss the mark. And so the intention of the way that we built this training was really to provide one model for doing this, with every understanding that people are going to take from that model what works for them and leave the parts that don't, and build upon populations that you serve, such as veterans and military folks or military families as well. Mm-hmm. So please know I take no offense to that. I think if you have additional tips to share from your experiences, that's great. I welcome those. And moving on from there, considerations for engaging in conversation. Is everybody here clinical in nature, or are there some folks that might be approaching these conversations from a non-clinical?
We have both.
Both. Okay, mm-hmm. That's really helpful to know. So we'll talk a little bit about engaging in these conversations from both a clinical standpoint, but then also from non-clinical. And then moving on from there, program implementation considerations. And then we have with us here, you will have your own demo kit that you can see. It looks kind of like this. We have found these to be super helpful in the clinical context, especially those that work in really busy clinics, or maybe one team travels. A lot of our traveling social workers will use these. One social worker will have it in her trunk if she's zipping around or visiting lots of different families. We mail these to different folks. I've even heard of some folks mailing them to members of the team in advance of trips up to Alaska to meet other family members, because we cover 4 states in our region. But a lot of people can decide what they want with this box, putting all the materials that you might need to help hasten that counseling session that you have with patients in the hospital or in ambulatory care setting, so that everything is right there, ready to grab out. And then you have the ability to do some hands-on practice with the different devices for folks to determine what's going to work best for their needs. So that's kind of roughly what we'll cover today. Any questions, or does anyone have anything that they're really hoping we lean into or spend more time on? Okay. Yeah, no worries. Okay, thanks for the thumbs up. I appreciate that. So maybe just kind of going back, I would welcome an opportunity, especially given we're a smaller group, to kind of have an understanding of folks, like your name, what team are you on, or what is your role, and a little bit about. I would love to better understand what your experience is on counseling and on firearm storage and distributing locking devices. I'm happy to start if that's helpful. As I mentioned, Christina Delgado, a nurse. Previously for over a decade, I worked in the emergency room and as a forensic examiner. So caring for patients, post very diverse forms of interpersonal violence. So really, certainly in the emergency room, lots of experience caring for patients coming in with gunshot wounds. Certainly as a forensic examiner, anything from like going to the OR to retrieve fragments or to work with patients following an episode where a firearm was involved to determine next steps, to collect any forensic evidence, to conduct interviews. My role here at Seattle Children's is relatively new. I've been doing this work for about 2.5 years now, and I will say I've learned so much in doing this, especially from those sort of upstream prevention standpoint and understanding the epidemiology of firearm violence and really thinking through interventions that have worked. I have most experience really working with other clinicians or community members at community health and safety events, distributing locking devices in those contexts, and really talking more generally about how to start a program, with other healthcare organizations. I would say, and of course, researchers, working a lot with researchers, both at the hospital for quality improvement in our emergency department, to working with folks over at UW FIPRIP, the firearm injury, policy, firearm injury. It's like such a mouthful.
Right. That's why the acronym's easier.
Yes, exactly. And so, and a lot of that work has really been around, like, when we have programs like this, why don't they work? Like, what's the problem? And I think we know that, first of all, like a lot of this type of work is not taught in medical school. It's not taught in nursing school, not taught in a lot of social work programs. And then often when you start at a healthcare organization, this is not the kind of training that is generally included. So there's already that sort of gap in providing the education to begin with. And then we know, clinically speaking, like when there's hesitance or a lack of confidence that you have all the information you might want to engage in a meaningful conversation with a client or a patient, there's going to be hesitation there. And then we also know that when it's not in the electronic medical record in a way that supports that conversation, that can be a huge barrier for groups. So I think kind of working through some of those quality improvement efforts, that's really kind of where I come to this work. A little bit of my background. So I'll be quiet for a moment so others can talk.
Oh, I guess I have to go next. So my name is Don. I am the suicide prevention team lead. My experience so part of one of the big pushes in our team recently has been distribution of lethal means safety devices. So we hand out lock boxes, trigger locks, magazine locks, rifle cases, any type of firearm safety device to transitioning service members primarily has been our big focus, because there is a known gap of the deadly gap year. So within 365 days, service members are at the highest risk for suicidal thought and ideation. So we make sure we try to catch those guys as they are separating from service. I've also participated on JBLM. They did a lethal means safety event where they had about 75 to 80 service members show up, and they distributed safety kits. And I got to be there, and I had to help demonstrate implementing these devices with some of the service members. So we've been doing that.
Great. Awesome.
What else? I think that's a good chunk of it.
Yeah. What was in the safety kits, just out of curiosity?
Lockbox,
Yeah.
trigger locks, safety glasses, ear pro, a hat, cleaning kits.
Right
and it was
on.
all through DOH had provided them, I think, 200 of these kits.
That's so great. Yeah, that's awesome.
I tried to get one, but they said no.
Really?
I was not a service member.
Oh, sorry.
I did not count.
Yeah. Thank you for sharing. I appreciate that.
Yeah, so I'm Nicole Breland. I am the suicide prevention manager here at WDBA. In my other, my other hat that I wear, I work in an emergency department, still doing mental health evaluations on individuals coming in with behavioral health issues and crisis. Sometimes it's safety planning if they have firearms, how to work with families, law enforcement if needed, just to make sure if we're sending them home, that they have locking devices in place or somebody to store their firearms for them. Sometimes it's talking with families because a firearm was used for self-harm.
Yeah.
But luckily it was unsuccessful for whatever reason. But it's working with families on just trying to wrap their brain around crisis and what happened and the trauma that comes with that. Because one of the hospitals I work at is a regional trauma center. So,
okay.
So it's mainly that. And then of course, what Dawn said, we go to events where we hand out locking devices, the trigger locks. The last one we did was Dawn did one for the Soldier Recovery Unit on Friday.
Oh, right on.
My event was the city of DuPont. The police department hosted an event. So we did that because it's a military community, large military veteran community. And then, that's pretty much the work that we do here. And then, as you know, the Governor's Challenge. Group 3 is lethal means, and Nicole with Cohen Clinic, brought to our attention that we need to work on safety planning too, and developing safety planning around that. So that's something that's in the works.
Right on. Yeah, very needed. Thank you.
Absolutely.
I appreciate that.
Yeah.
How about for those of you online?
You, Holly, on my phone. Okay.
I'm trying to unmic. Yeah. Great. Thank you, Don. So I'll go ahead. I am Holly Stingline. I'm our suicide prevention program specialist here in Eastern Washington. So I cover Spokane and a bunch of the counties over here. I also distribute lock boxes and trigger locks. It's a grant funded program, so they go to transitional service members. So I spend time on Fairchild talking to service members, active duty, transitional service members, just trying to educate them on lock boxes and trigger locks and demonstrate how they work. And I think I've given out, I'm fairly new. I mean, I've been with this program for about a year. So I've given out probably 100 lock boxes. So quite a few, still have a lot to give out. But I will say I was able to go to the Firearm Violence Prevention Conference last year. And that was a really amazing experience for me just to learn about how much firearm violence we have here in Spokane. And we had a lot of doctors from Sacred Heart, and we had the fatality review and prevention coordinator there telling us stats here in Spokane. And it was really, the doctor that came on was from Sacred Heart. He also specialized in pediatrics. And the numbers to me were astounding of how many accidental deaths there are from firearms here just in our little community. So that was really eye-opening for me. So I was eager and excited to, hear what you do and how we can do better. Because really that's my job, is education and training and trying to figure out how we can prevent, lethal means safety, or help with lethal means safety, prevent suicide.
Oh, that's awesome. Yeah, thank you for sharing that. I'm curious, was that the one with Excelsior? Was Excelsior Wellness a part of that? That's so exciting to hear. We trained, like, this was back when this program was beginning during the last funding round or the last biennium. We partnered with Excelsior was there, Sacred Heart, Providence, I guess, Sacred Heart. And they even had the ESD 101, is that right? For the school district, they had the threat assessment team there. And then Mia Morton, at Spokane Health, their health department out there. And I think that's always a really key message taken away from any of these trainings where folks have a clearer understanding of what this looks like in our community. That's deeply impactful. That's so cool to see that I remember there being some conversation about this conference that they were getting up and running. So I'm so excited to hear that came into fruition and that you were there for it.
They did a fantastic job. I really enjoyed it. I learned a lot. Really scary stuff, but important and impactful too. So it was great.
So, thank you for sharing. That's great.
Hi, I'm Michael Cannell. I'm the data person for counseling and wellness programs at the DVA. And I'm kind of joining the suicide prevention team on a few meetings and trainings and events just to kind of learn more about what they're up to and you know, the work their team is doing. And
That's
I don't have,
fantastic.
yeah, and I don't have any experience with firearm storage or locking devices or anything like that.
No, thank you. I will be keen. Do you work also then on data visualization or helping with data tables
Um,
or dashboards?
yeah, a little bit.
Okay.
It's yeah, just kind of whatever the various programs and stuff need.
Oh, I love that. That's so useful. Thank you. I'll be really curious to hear, Michael, if you have any feedback on some of the data tables that we go through here in a little bit.
Guess that leaves me, Gary Lott, and work in our communications, that covers kind of social media communications, networking, and outreach. I will call myself a novice in the firearm game here, the lethal the lockbox and game here, if you will, but just trying to gain as much knowledge as I can with working with the suicide prevention team and just learning more about the work that we're doing as well with Governor's Challenge. And so excited to learn more today.
Awesome. Thank you for being here, Gary. I appreciate that. And thank you everyone for sharing. Is there anyone that I'm missing or anyone that still needs to talk? Or I think we're all covered. Wonderful. I'm going to move us forward then. Thank you. And again, folks, I want you to feel very invited to come off of mute and at any point, if there's any comment that you have, if there's anything that's unclear, anything you want to push back on, I'm all ears and I'm here for it. So really quickly, I don't think we need to dwell too much time on this part, but just so you have a better understanding, I think our goal is really to continue to collaborate, as we move into this next biennium. I will say in the last biennium, our team at Seattle Children's worked really closely we did trainings at Madigan, like the Rainier Embedded Group. We have worked, of course, with the Guard, even the Sexual Assault Services team, like was in attendance there. Through Governor's Challenge, we did an evening training working with the folks over at Nine Line in Fife. I guess it's kind of on that border between Tacoma, Fife. So I just want to be clear, like always happy to collaborate or to turn over. I know that there's a lot of hunger for these conversations to continue and for folks to work together. And I think, I grew up in a really strong military family. My mom was an Army nurse. My stepdad did 3 tours as a Navy corpsman in Vietnam. My brother just retired. But I have not served. And so I think I do feel really strongly that often those messages and having those conversations is really best when there's that connection, that shared connection with you all. So I never feel that sense of territorialness ever. So I'm always happy to, share resources or to hand over the reins to anybody that's wanting to do this work wherever you are. There's no shortage of need. I think that's very clear. So just this slide here is really just if it comes up in the course of your doing this work, because a lot of the communications that come in through to me are frankly from people who have heard about trainings or want these resources but don't know where to turn. And so please know that for Seattle Children's, like we have not finalized this next contract with the Department of Commerce, but we plan to do something very similar. It'll just be much improved after everything that we have learned over the past year. But basically everything is free. There are no strings attached to anything that we do. The only thing that I ask for is that folks provide genuine feedback, even if it's critical, honestly, because sometimes that's the best feedback to have. I don't want to be out here saying something that's offensive to somebody or alienating, or if there's some standard of practice I'm unaware of, that's always really helpful for me to know. So the only thing we do ask for is that folks provide robust feedback in an evaluation. But our goal is essentially with this project to increase access to safe and secure firearm storage devices, the devices that we use, and to give resources, of course, for folks that may want vaults or safes or any number of other types of locking devices that we do not offer, and to provide education to communities across the state. We do that through a variety of ways. We have a healthcare provider toolkit that you will all receive a copy of. Please know that there is an updated version in the works. We also have a print copy of a community education toolkit. I have some of them here. But basically, these toolkits provide implementation guidance for folks who want to initiate this type of programming. And of course, in addition to that training, that can take about, like I said, 60 minutes to 90 minutes. It can be virtual, in-person, hybrid. We try to provide a copy of the print toolkit, an online version for folks. And then in addition to that, your own demo kit. We do a one-time allotment of devices to an organization. So free, one time, we ship it to you, or I bring it to you at the training, if that makes more sense, of lock boxes, trigger locks, and combination cable locks and keyed cable locks for you to distribute as you want. There's no metrics that you need to send back to me, like it is all yours. I trust that those of you engaged in this work know your communities better than I do, and you are better positioned to distribute those in a way and in a manner that makes sense for where you are. In addition to that, we know that ongoing training with a lot of healthcare organizations in particular, there's a lot of turnover, right? And so oftentimes that's where there are challenges or barriers for organizational sustainability. So you'll get a copy of the slide deck, and then we have access to all the education materials that we'll go over for you to use to do your annual competency trainings or refresh trainings for folks. All the educational materials that we use, you have access to them. If you have an interest in taking them and then putting WDVA logos on there or tailoring it to better meet the needs of service members and their families, you can sign a licensing agreement, which gives you the actual original template. So you can remove Seattle Children's, put your own logo on there, and then add data that better meets the needs of your populations. So please know that's also an option. We also recognize that, it's a finite period of time that we have this funding and we're able to do this. I have every intention, if you're interested in sharing, our local supplier who gives us the devices, Sportco in Fife, and they have very generously offered to extend the same discount they give to Seattle Children's to any organization that is interested in doing secure firearm storage work. And so it's simply a matter of me putting you all in touch so that you have access to the same discount that we have, and you can arrange all of the shipments, without needing to go through me. So it's really meant to share, again, like truly. Any questions about this? I know it's a ton of information and I'm kind of stumbling through it here quickly, but any questions about that information before we move on?
No.
Okay, great. These are the toolkits. And I think, if there's one, not to be a total cheese ball, but like genuinely, if there's one theme or like the spirit of the work that we do is just in deep recognition that folks come to these topics or talking about firearm storage from very different perspectives. We respect that, we appreciate that, and truly the diversity of those perspectives is what gives this work strength and momentum. And I feel really heartened by what I hear. And I mean that genuinely. We have worked with folks across the political spectrum. And I think honestly, some of the most valuable learning experiences have come from when working with folks who engage in shooting sports, who are hunters, who own firearm ranges, who maybe come at this from a very different point of view. And I'm grateful that they feel comfortable sharing that. Even certain law enforcement agencies that we've worked with across the state, sometimes that can feel a little intense when someone is questioning certain things, but it's also a great moment of learning and listening to each other. So thank you for being here. And I will proceed from here. I always like to preface this section before we dive in with just saying that especially when we're in a clinical context, right, we tend to just cruise through these numbers in a really fast fashion. And I want to recognize, I know we're talking about individual lives that have been lost here. I know that a lot of those folks had loved ones, people who cared about them, and I'm talking about numbers here. So I do just want to take a moment to acknowledge that. I also want to say that the data that you'll see here is also will be updated. As I mentioned, we're in the process right now of finalizing our next contract. The Department of Health for Washington State does a wonderful data analysis for our organization, and they provide robust information that covers our age ranges 0 to 21. Sometimes, as you'll see here, it's up to 24. But with this slide, I'm really hoping to draw your attention to, as I mentioned, our team is very, very small. And so Essentially, right now, I'm one person that covers 4 states for the 2 leading causes of injury death for pediatrics. Poisoning, which you'll see here, essentially what we're talking about here is fentanyl. There's no question about that, or synthetic opioids. So when we see poisoning here, that's like a quarter of the injury deaths in Washington. As many of you are probably well aware, Washington kind of holds a unique position in the sense that we often exceed. Fentanyl or drugs are actually the leading cause of injury death. Compared to many states where it's firearms, and it kind of toggles back and forth. They're very close, but really poisoning is a leading cause. And then of course we have roughly a quarter of the injury deaths for people aged 0 to 24 related to firearms. And so when we're talking about firearms in this orange slice of the pie, we're really talking about suicide, homicide, and some unintentional injury. Unintentional injury is really a pretty small sliver of this pie. I want to be clear about that. But we cover this, of course, as a children's hospital in particular, because there's a lot we know we can do to address the unintentional injuries. And when we say unintentional injury, what we're really talking about there is usually really small children who accidentally uncover a firearm. We know that starting with the age of 3, somebody has the strength and the dexterity to pull a trigger in the event that a child finds that firearm. We also know that kids are naturally very curious. You know, for those of you that have little ones, you know, they're opening those drawers, looking in the cabinets, and if they uncover a firearm that is unsecured and loaded, there can be certainly a horrible accident that could happen. Most of this, though, is really suicide and homicide. And Washington State, like many parts throughout the country, you know, oftentimes there's a relationship where when you compare urban to more rural areas, there's an inverse relationship that you see where suicide is generally much higher in rural areas compared to homicide, and oftentimes homicide is much higher in urban areas compared to rural. That's not always the case, but that's generally the situation. And of course, as I'm sure Holly, you probably heard this in Spokane, there are also in the Pacific Northwest more generally, we do tend to have higher rates of suicide when compared nationally. Any questions about this information? I like to start with this too, because this really does tend to lead our work on the community health team. We try to allocate resource where we know the greatest issue is. And so we have a lot of resource to really tackle these top two issues here. Questions about anything else or anything that you're seeing on here though, before we move to the next slide?
Is there any data or maybe more speculation of why the Pacific Northwest has more suicides?
That is such a great question, and that has come up. I feel like that is actually on my long list of things. I think especially in Spokane, I remember at that training, there was some robust conversation of like, but why? Like, what is it about this region of the country? I don't know. It's a really good question. Let's continue the conversation. Because I'm very curious as well. I mean, I've heard, and if anyone on the call has, anyone online has additional insights, I'm all ears. I have heard anecdotally people talk about like the darkness here.
Yeah.
You know, like how it tends to be really dark and rainy, having a detrimental impact on well-being or mental health.
Yeah.
I don't know if that's true. I don't know if there's evidence to it, but I have heard that anecdotally pretty frequently.
Yeah, like lack of vitamin D, where most Washingtonians need vitamin D supplement, especially since it's not fortified in our foods. Like, you know, when we're younger, we have milk, right? Like when you go to your cafeteria, there's like a milk and it's has A and D added. And so kids are getting it. But then as we age, how many of us are sitting there with glasses of milk or hardly anybody. And then also our diet changes as Americans and convenience and all of that. In addition to darkness. I mean, that's again, totally anecdotal data. And or not even data, but it's just anecdotal thought process on that, along with the vitamin D thing, because most of us are vitamin D deficient because we lack sun.
Yes.
So
yeah, it's interesting. I think also, like, I don't know in terms of just like the rates of firearm ownership. I mean, I know that like one in three households is like that number that gets thrown around a lot. But I don't know if it's higher in some places. I also would be really curious to look at, and I think Governor's Challenge, like different groups work on upstream, like connectedness and community, right? How close do you feel with your neighbor? How robust or strong are those connections with others where you feel you can like have conversations about how you're feeling? Yeah, it's a great question. And I think I would be very curious. I'm very curious. I'm really,
more to come.
More to come. We break this down. I'm sure many of you are familiar with CDC Whiskers.
But this sort of breaks it down by age category, which a lot of folks, especially for a children's hospital, find very helpful considering they often work with different age groups. I think what's really striking to a lot of folks is understanding that firearms start to become a leading cause of injury death starting at the age of 1. So we see here in these homicides, for example, and then really starting from about age 10, suicide by firearm starts being a top 3 leading cause of injury death, including still homicides down here. And of course, these age groups go up to the 24 age range where you see that number jump pretty significantly, as you will probably note. And of course, when we're talking about pediatric on a scale, obviously this scale is nothing compared to adult populations, but I think we're also talking about a particularly vulnerable group when we're talking about pediatrics. I know that these slides can be really heavy, so I want to just be sensitive for all of us, but I tend to be, I think, not as sensitive as I could, but like when you're in a clinical context, because we do see this, every day that we're in there. And I think this is really helpful because I think for a lot of folks understanding lethal means, they come from different levels of understanding or foundational knowledge, but really, and I know you two know a lot about this too, so please jump right in. But really, when we're talking about lethal means and when we're thinking about something called lethality, we're really talking about these different components when we think about mechanism of injury and case fatality rates for suicide. We think about the irreversibility, right? From that moment that somebody decides, I just don't see any way out of this. It's never going to get better. The world would just be better without me. From the moment that decision happens and they've decided to act upon their plan, really when you start looking at the reversibility of something, it's like from that moment that action has been taken, how likely are we to be able to reverse it? If you come into our ER and you have overdosed on some medication, the likelihood that we're going to be able to save you, give you some life-saving intervention, provide supportive therapies until you're better, give you a reversal agent or an antidote is pretty good. Right? Like the leading cause of suicide attempts is medicine, right? But again, only 13.5 of those deaths result because often we can do something to help you or to save you once you've started down that path. Sadly, with things like jumping off of a tall building, for example, or something as tragic as a firearm, we know that those are very dangerous things, right? Like the moment that you pull that trigger or take that jump, the likelihood we're going to be able to do something to intervene is not very high, which is why you see like firearms and hangings accounting for only 8.8% of the acts, however, 75.3% of the deaths. And I do want to be clear that with this data that we're looking at here, this includes all ages, and this is national data, so not just Washington specific. But we know that firearms are very, very lethal, which is why we really try to assure that we're having meaningful conversations about removing that firearm if we've got someone who's feeling suicidal or in a really dark place, and that we have a lot of awareness when talking about certain patients like adolescents who might be more impulsive in nature. Any questions about this data? I know this is really heavy subject matter. Any thoughts or clarifying points or something that you would add to this? Or anything that looks funny or off to you?
I think there's no question about this. I mean, that probably coincides with like my whole thought process about, with numbers. I think it's important to, and I don't know the data for children, this is for veterans and I assume just adults in general. About 70% of suicide attempts include substance use.
Yes.
And how important it is to bring awareness of substance use disorders and the impact on that decision-making capacity in that moment. Because in my experience, and as you know, in the emergency department, they call them, I'm not saying this is an appropriate term, but they call them like the drunkicidals, right? They're drunk.
Yeah.
I am suicide. I want to die. And then they sober up and they're like, oh no, I just said that because I was under the influence. But how many of these deaths, which is I think around 70-ish%, it has these folks have substances on board of some kind. For veterans, it's alcohol, and then but the number one leading cause is synthetic opioids, which is your fentanyl.
100%.
Yep. And your analgesics, so your other stuff. So
and probably benzos tossed in there too. Thank you, Nicole. That is tremendously helpful. And it almost like makes me want to jump to this. I'm really glad that you provided that additional context. We touch on that really briefly when it comes to the Washington firearm storage map, like if especially thinking through risk factors. So like if substance abuse is happening in addition to feeling suicidal or feeling deeply depressed, we know that these are risk factors we can be on the lookout for with our loved ones. But I think you brought up a really, and I know this sounds dark, you guys, I'm not trying to sound callous in any way, but I have been doing this for many, many, many years. And this is something I hear. I don't know if you've heard this, but this idea that like, well, if somebody is wanting to die, they're going to keep trying until they do it anyway, or eventually they're going to, they're going to pass away or die by this. We know that that's not true. Suicidal crises are often transient. They are often brief. When somebody is in that intense emotional distress and pain, it's really just a matter of needing to get hooked up with the right services, needing to just work their way through that painful period and move on from it, often aided by the assistance of therapy, of help, maybe substance use treatment or other things like that. So I really want to, I know this is kind of a lengthy point here, but this middle one, most people who survive an attempt do not eventually kill themselves. Yet a significant percentage of people who do die by suicide, approximately 60% in the US, die on their first attempt. So means reduction saves lives by decreasing the likelihood that an attempt will be fatal. And I think, again, this last point on here, restricting access to legal means for someone experiencing a mental health crisis can allow for time and space. We use that a lot. Time and space is what we're giving. Time and space for that intense emotional distress to lessen and to receive support and care. We use one segment from a study where they looked at adolescents and and it's not too dissimilar for adults, I believe, but really from that moment when the decision of I think suicide is my answer to acting on that can be under 10 minutes. And so especially for young people, really giving that time and space is what we're looking for here. No safe and secure storage option is going to be foolproof 100% all the time. But it is a wonderful way and a really impactful and effective way of providing time and space. We know that if that youth cannot access the firearm, that's part of their plan. If they cannot access, some ligature that they have in their mind, oftentimes that moment of intense emotional distress is going to lessen. And if we know that if they don't have access to the supplies they need to carry out that plan, they're not going to try again, oftentimes in that moment of crisis. Questions about that, or was that clear? I don't know if I said that as clearly as I could have.
Yeah,
but
very much. Don, do you want to talk about what we do with the magnet? So Christine, about the magnet.
Yeah.
At David Concord.
Oh, hey.
So one of the things we do when we distribute our lethal means storage devices is we include and I'll grab one before you actually.
Yeah. Mm-hmm.
Of course I carry one.
Hey, awesome. Thank you.
We provide these little pouches and inside of it has a magnetic picture frame.
Yes.
And I like to phrase, and when I talk with service members, I'll be like, put whatever you want in there just as a reminder.
Yeah.
It could be your car, your pet, your spouse, your children.
Yeah.
Whatever it may be, to be like, oh, well, if I do this life altering event, this person, this thing will no longer be around for me to care for. So we like to give them that little one extra hesitancy.
I love that.
And we always make sure, because everybody has kids, especially when I'm talking to these 19-year-old kids who are getting out. And I'm like, well, do you have a car that you really like? And he's like, yeah. And I was like, well, where do you think that car is going to go?
Right.
Somebody who's not going to care for it. And he's like, I don't want that. So
yeah. I love that. And I think I appreciate how it values, what gives us meaning in life. And I appreciate that you are also recognized for those that don't have children, there can be all these other, your pet, especially, right? Oh my gosh, that brings a lot of value.
Well, because we know families aren't always a protective factor.
Precisely.
Not everybody has a strong supportive family, so it could be anything.
Yeah. Thank you. I really appreciate that. I really like that a lot. Thank you. I appreciate seeing this as well.
Well, it also helps put more time in place, time and space before making that, because you're sitting there contemplating at that moment.
Yeah.
And you see this and you're like, do I really want to do this? I'm going to miss them, or, so it's trying to add additional time before a very impulsive decision can lead to something that's for a forever decision.
Yeah. Yeah. Thank you, Nicole.
Did you have something?
Yeah, I just wanted to share really quickly. a story that I always tell when I do our suicide prevention training, because I think it was really impactful. And a lot of times we don't get to hear the success stories necessarily of the work that we do. And I had a female veteran, come up to me when we were at Fairchild, and she said, "I just want to let you know that the safe storage box saved my life. And if you don't mind, I want to share my story with you." And I was like, "Oh, heck yeah." I was so excited to hear what she had to say. And again, it was like you said, putting that time and distance between such an impulsive act. So she always kept her firearm in her nightstand by her bed, and she got a lockbox distributed to her. And so she put her firearm down in the basement, and she was having a very impulsive thought one morning in bed. And she said, if that firearm would have been in her nightstand, that would have been it. And she said, it literally saved my life, because a couple things had happened, that day, that morning while she was in bed, that, whether it was a call from her mom or just positive thoughts, but just putting that time and distance between that act saved her life. So I like to share that, just because I know, again, we don't always hear impactful stories, and that's the work that we're doing, showing that it's making a difference, and it helped one person, and that's huge. So I just like to share that.
Oh, thank you. Thank you, Holly. I appreciate that.
You bet.
Thank you. Anyone else have anything before we move on? Okay. Well, truly, at any time, if folks have other things they want to add, please do so. I'm going to back it up to the slide that we skipped here. And this really just helps, I think, to illuminate what we're talking when we think about mechanism of injury, firearm. We know that roughly half of the completed suicides that occur for folks aged 0 to 21 in Washington were situations where a firearm was involved. So I'll give us a moment to just look at this. Any questions, please feel free to ask. And then we'll move on.
With suffocation, does that include like hangings or?
Yeah.
Okay.
Yeah.
Because I do know part of our lethal means safety brief we give on JBLM is to include like the changing in the data, right? And so what we're seeing in the service member population is it's been like an 8% increase in suffocation and hangings.
Really?
And so, and we're still seeing an increase, unfortunately, in firearm deaths, but in the veteran side, we're seeing a decrease.
Okay.
But we're still seeing that increase with the hanging and suffocation.
That's really interesting. I'd be curious to know more about how you safety plan. And with that in mind, I know that the lock boxes clinically at Children's, these are actually used often for all lethal means. Like they'll put meds in here, sharps, razors, knives, ligatures or other like ropes or something that could be used for a hanging could certainly be placed in here. But I imagine there's got to be more involved there with respect to the safety planning that you go through and thinking about mitigation, risk mitigation.
One of the approaches in the military, and at least how it used to be, was like if you were at risk for suicide, they removed your belt, your bootlaces, things like that. But in your home, like that's every cord, cable, any type of rope device. So it'd be interesting how that would be.
Well, it also doesn't stop somebody from going to another location. To carry it out, to implement that where there is other means readily available to, other than, they sweep, like we say, oh, what do you have at home versus you can go to a hotel, which many people do, right? I mean, you have things in there, you don't, so with that, I don't know. I'll share this with you. I can make a copy if you want it, but it's this checklist that I don't know who came up with. I don't know if it's Army and Air Force or it's one side versus the other. I don't know. I think it's military wide, but it's a checklist for leaders to go through and do this checklist to make sure, and that includes the lethal means safety and then referrals and such. But I do want to mention though, there's two, luckily, I mean, I want to say luckily because two is too many, but 2 deaths on JBLM that happened in July and August, both male, 1 firearm, 1 hanging.
I'm sorry.
And 0 on the Air Force side. And it's interesting because if we go back to the theory that we mentioned earlier, right? I mean, everything's a theory and not 100% absolute. But if we go back to the whole vitamin D thing, or why is it happening more in the Northwest, that they both happen during the summertime. So it's, so interesting patterns. And then with your data on the other slide too, is how many of them, how many of these percentages are male, female,
Oh, yeah.
non-binary.
Yes. Mhm.
Too, because there's a lot of, again, it's just, if we're looking at trends and patterns, it'd be interesting to see, because with the veteran community
Mhm.
and active duty, I mean, just this year, 2 males, no females. So,
Mhm.
and there's more males in the military than there are females. So
Yeah.
given that, there, what your data shows too of how many are, identify as female, male, non-binary, et
Yeah.
cetera.
That's really helpful contextual data. And I know, like I said before, this is like this is an area where you tease out what does this look like for service members or for veteran populations. There is, and I'll point to it at the end. It's one of our final slides in the additional resources, but the data dashboard has been undergoing a huge revamp and update for the Office of Firearm safety and violence prevention. So a lot of the researchers, I think at UW-FIPRIP, have been working to repopulate that data.
Cool.
And they even have kind of like SUDORs, like the surveillance system where you get a sense of circumstances surrounding overdose.
Mhm.
It's, I think, intended to be very similar, given the circumstances surrounding suicide, recent job loss, recent divorce or relationship break, for example,
Mhm.
all those sorts of things that we know can be risk factors. I don't know that they pay much attention or are able to capture protective factors. I think that's always so much more challenging to tease out, but that might be helpful information to think through, because I know that they break it out by age. So would go well beyond these to capture full adult populations. And then, of course, we know after 65, you see that uptick. I'll try to make a point to highlight that at the end for folks who want to dive into that data, the publicly facing data dashboards a little bit more. I will say this is also going to be updated. Sadly, I think these trends are pretty steady though. And again, population level data, this is not to suggest that there are not counties that would be present with a lot of smaller counties. Keep in mind that a lot of the data might be suppressed because of privacy issues or if those numbers are below 10. But I think one thing that's evident when you look at this here, these are all mechanisms of suicide, just to be clear. And this is all firearm death. So Grant, Yakima, Pierce, Benton, so like that Tri-Cities area, King County. But you can look at the rate per 100,000 over here to see like Grant County, holy moly, like that's exceptionally high comparatively speaking, right? And then the non-fatal firearm injury, some folks will ask, what do you mean by that? This is essentially looking at a lot of that Rhino data or a lot of the surveillance systems that look at hospitalizations or when people come into the emergency department, what's the chief complaint? So these are folks that come in with gunshot wounds, for example, and are discharged or hospitalized and then discharged. They have not passed away or died. So I'll be quiet for a moment. You'll see for those that are highlighted here, this is just intended to show or to demonstrate. We have about 5 counties that really pretty consistently have higher than the average rate levels of firearm related injury, violence, and death.
Wow, Grant County.
Yeah. Yes. Mm-hmm.
Huh.
Anyone have questions about this information before I move on? And you'll have access to this, as I mentioned, like you'll get these slides. I'm happy to share the updated slides when they're ready in a few months. Potentially even sooner, but at least a couple months.
So this is, okay, ages 0 to 21.
Yeah, ages 0 to 21. And again, with any population level data, there's going to be a good 2 to 3 year lag. So with the next data set, we're hoping to get 2020 to 2024 data, but it's possible it'll just be 2019 to 2023. And we do know, like something that you don't necessarily see on here, we do know that homicides experienced an uptick over the pandemic, those latter years. Any questions or shall we move forward?
So the Grant County one, is basically all of them were dead they were all suicide. They weren't like an accidental.
It looks like it compared to this, but I would want to honestly see, because I know there's a lot of gang activity out that way.
Mm-hmm.
So it's possible that's the suicide. It also is, it just happens to be the same. Yeah.
Wow.
Any other questions, y'all, before I slick to the next or comments? Okay.
I am most shocked by that one. I mean, only
the
the
Grant
County is the higher population, right? So, I mean, amount of people, but yeah, the Grant County.
Yeah, it's pretty striking when you're out. I was out there working with their health department, and then they had like folks from their WIC program that were going to be distributing firearm locking devices from their women, infants, and children program. And it was, I think at the time that I was there in the training, they had 3 firearm incidents in the past like 3 weeks or something wild like that. It was, obviously folks were deeply impacted. Yeah. This slide here, I think, is also, I think at the time that I was there in the training, they had 3 firearm incidents in the past like 3 weeks or something wild like that. It was, obviously folks were deeply impacted. Yeah. This slide here, I think, is also really intended to disaggregate by race and ethnicity. I think we know this, but it's one thing to also see it in the data. We know that we have a lot of work to do with the American Indian and Alaska Native groups, a lot of our tribal communities. This is not all tribal communities, but a lot of the tribal communities have exceptionally high rates of firearm-related fatality, especially suicide. I will also say, like, for, to provide a little bit of hope, or something more positive, despite all this depressing data. I know that actually not too far from you all, like in Pierce County, I know they're doing exceptional work with a lot of their, not just tribal youth, but even like their Pacific Islander youth. They have groups there that are really working to embrace this like culture as prevention. So to kind of like reclaim this sense of pride, in your heritage, in your past. And they've had wonderful success. And again, kind of tackling those upstream things that we know are deeply protective in nature at preventing suicide. And firearm injury more generally, where you feel that sense of connection with your community, where you feel you have somebody that you can have a meaningful relationship with. And so there's exciting work happening there that shows a lot of promise for youth and connecting a lot of young people with economic opportunity, right? We know that a lack of economic opportunity is an identified risk factor. So any opportunity to provide mentorship, to provide job opportunities, internship opportunities, a clear path to whatever academic trajectory that might be, trade school, higher education of some way, training to do a specific trade. Any comments about this before we move forward? Okay. This last data slide here is really just meant to kind of illuminate, why do we choose the types of devices that we do? Well, because we know that, for a lot of the firearm fatalities, about 69% involve a handgun. So all of the devices that we distribute in our program would be very appropriate for use in a handgun. I know that, as we mentioned, with vaults or safes or devices that might better meet the needs of folks across the state or folks that have multiple firearms, for example, we can provide resources for folks to get discounts on those types of locking devices. We also know that over half, or roughly 62% of firearm fatalities happen in a house or an apartment. I think this is also a good time. We will not dive into it here, but we also do know that a lot of firearms are kept in people's cars or on other parts of their property. So I think it's really, especially for those clinically inclined, like really assessing whether or not that firearm, if you're asking somebody, is it in your home somewhere, making sure the language you're using in those questions encompass those other spaces that we know people keep their firearms locked up. Okay, we'll take a breath from the data. I know that's kind of heavy. So we'll transition away from that. And I think really the key point, and I think we brought it up here, is for a lot of organizations, you're going to want data that better includes or is more inclusive of some of the adult populations or even senior populations that you serve. There are all of those resources available. I know that there was recently, I haven't watched it yet, but I have access to the recording. I know that I think Brady just did a whole webinar on advanced care planning or for folks with dementia or thinking through firearms for older populations. So, and safety planning around that. So, how you talk about or include firearms in advanced healthcare directives is a whole space that like we don't have time to talk about today, but there are resources available out there. We will focus exclusively on safe and secure firearm storage practices, despite understanding that strong laws that limit public carry, though people definitely have different feelings about that, this is an evidence-based solution to address firearm death and injury prevention. There are also community violence intervention programs. Again, we're not going to talk about those here today. And of course, ERPOs and DVPOs. I imagine you all have far more expertise in that area than I do. Mine essentially, my area of knowledge and expertise that is really knowing where clinically when caring for a patient, who to connect them with, which social workers or others that can help walk them through, or advocates if, you know, in those situations with a SAPO, like a sexual assault protection order or DVPO. We're not going to talk about that today, but we do have a resource at the end or other places to turn you to for additional information. And I feel like both Nicole and Don, it sounds like would be wonderful resources for people to turn to with additional questions about ERPOs that might pop up. So with that in mind, like just being really clear, when we talk about safe and secure firearm storage, we're really talking about these devices that are intended to keep your firearm locked up, or something that will effectively keep that firearm out of the hands of anybody other than the intended user. So some locking device of some kind. When we talk about safe and secure storage at Seattle Children's, we are always focusing on safety, always with safety. We keep it politically neutral. We're not going to dive into a lot of those conversations, especially in a clinical setting. We try to focus on the positive messaging and what we know to be an effective intervention at preventing against homicide, suicide, and unintentional injury. Does anyone have anything to add about that, or anything to say when your understanding with the RCW around secure storage or messaging before I move forward?
I just know from personal experience being in the community, the lack of education people have on temporary transfers and things like that has been pretty amazing, because most people don't know that you can do temporary firearm transfers. They think it's either law enforcement or like a court order kind of thing. So keeping that message out and keeping it on the front, I think has been super helpful.
Yeah.
But I also think that it's very difficult sometimes to use the word like locking up your firearms, or using terms secure or but then they're like, oh, well, it's hidden. So then you have to give them, well, hidden isn't secure kind of stuff. But because we get a lot of pushback sometimes in those rural communities.
I'm sure.
They're like, well, my kids know about guns. I know about guns. Everybody's fine. And I was like, well, does your kids' friends know about guns? Because they're going to be in your house, and then trying to spread it out more.
Yeah, that's a really good point. And I think Kelsey at FIPRIP, this question came up for me recently because it was out in a more rural setting where they were asking specifically for data, like with children and suicide, like, well, aren't they less likely to die by suicide, by firearm suicide, if they've had these firearm safety classes? My understanding is no, like it doesn't matter. Even if you grow up in a hunting family, you grow up doing shooting sports, it's really like, again, if you are in a moment of crisis, if you're using substances, if these other risk factors are present, that is not protective in nature, having that kind of education. If you have access to the firearm, that's really what it is about.
Well, and then thinking about our veteran and active duty population, they are definitely educated and experienced with firearm safety and trainings.
Yeah.
But we still have that's our largest demographic of death by suicide is firearms.
Yeah, that's a really good point. It's the accessibility of it. Yeah, I'm curious too if there's and for folks online who maybe will just bear with me. I love listening to both of you guys talk about temporary storage, because I think that's messaging we could benefit from doing more of. And I find it a little intimidating because I don't routinely counsel patients directly in temporary storage or a temporary transfer, rather, of your firearm. So if you have some key points or talking points that work well for you, I think everyone here could benefit from hearing them. Or hearing them again.
Well, how about you explain, and then I'll just quickly say, in your little packet, there is the RCW that talks about the storage too. So we give that out, and then the messaging aligns with the RCW. But when we were doing our lock boxes and doing sort of motivational interviewing with the follow-up, our data shows that most people say what the question is, do you know or have any, I don't know what the exact question is about, do you have knowledge or can you transfer a firearm in this state? Most people mark no.
Yeah.
Like majority. I don't know the exact number, but this is just our internal data.
That's really interesting.
But the messaging is true. And then that RCW, that card is not all inclusive of the RCW because, and then Don, you can talk about the messaging, but it's the temporary transfer of firearms it doesn't have to necessarily be, when I read it,
Yeah.
it doesn't have to be a family member.
Be anybody.
It can be
who's
anybody,
legal,
yeah. So a lot of people think, well, if I give it to this, or some people think that law enforcement is the only place. It can be gun store owners that are willing to secure. But with that, that's not all inclusive of the RCW that talks about that. And so.
So when I do my pitch, I explain it's family members
Yeah.
or loved ones or a close friend, somebody that's trusted with the specificness of legally able to obtain and own and possess a firearm. So like if you have Uncle Bob, and Uncle Bob is a convicted felon, he's not going to be able to hold that firearm for you.
Sure.
But with that RCW, it allows you to give it to Aunt Jen, who can own that firearm, and she owns maybe a couple others, so she can hold on to you. And it's for the duration of the crisis. And so it's specifically designed that way. So if, I hand my firearm over to Nicole and she thinks I'm good now, and she gives it back to me, but I'm not. I'm just very good at masking.
Yeah.
And now I go and take my life. There's no legal repercussions for Nicole to face because in some cases there could be because neglect, right? She gave me back a firearm that I just used to take my own life. And so it protects her. And I tell that to people because that's been something that's been asked. Right?
I'm sure I can
They're
see
like,
that
well,
question.
what if I give it back to them and then they end up doing something with it? I was like,
Yeah.
you're not at fault. There's an RCW that protects you for that.
Mm.
So I think making sure people are aware of all that because there are waits periods if you go through the legal system to do a temporary transfer. But with that, it's in good faith that you can hold on to it. So if it's been 2 days, a month, it varies.
I appreciate that. One question I have naturally when I'm hearing you is like, I feel unclear, but what about somebody like me? If I don't own any firearms, maybe I've taken a safety class, maybe I haven't, like, would I be able to hold on to that? Am I, or like, what is it, when you say somebody's qualified to, what does that mean?
As long as you're not a convicted.
As long as you're not a felon.
Like, wasn't ITA'd for,
As long as you're legally, if you are legally.
Sure I'm not.
Right. So you're good.
Yeah, because in the overall writing, it says legally own and obtain a firearm.
Okay, you're able to legally own and obtain a firearm. That's super helpful messaging. I think, thank you. I appreciate that. Any questions, or I'm curious if folks online have anything else they want to share, or if they have tips to add to the conversation, please feel free to do so.
I think a lot of people are hesitant, especially, I hear a lot of, well, that was my dad's firearm, that was his gun that he had before he died, and I'm not letting that go. I'm not letting that be secured. And it becomes very difficult conversations sometimes for those that you're trying to safety plan and you're trying to get them home or wherever it is that they want to go. But making sure they're safe too, because from a clinical standpoint, from a clinician, you're going to be held liable if somebody says, yeah, I have, and I specifically asked you possession and access. There's two different things.
Okay.
Don can possess it, and then he secures it at the local gun store that is willing, he's in a crisis, his, wife helped him get him there, you're secured. But nothing prevents Don from going to Cabela's and purchasing another firearm. So the access part, pretty much everybody has access, but so I ask that question, especially when safety planning, and I will document that.
I think that's important. Yeah.
Right. Versus do you possess firearm? Well, no, I don't own a firearm.
No, but my wife does.
But my wife does, or I can, because I'm not a convicted felon or whatever, I can go to a gun store easily and just go purchase one. I may not. And if you have a CPL, then I just have to do my application, and within an hour or so, depending how busy they are, I can go home with one versus having a waiting period if I don't have a CPL. So it's interesting, so it's from a clinician standpoint is asking that possession and access.
Yeah.
It's two different things because sometimes, again, they may say, no, I don't have access to it because I have a background. I have a criminal background, so I can't do that. Or I've been ITA'd, I've been detained before for mental health, and so I don't have access for, I can't. But it's trying to do our due diligence at identifying where those firearms are located and minimize the access, because anybody can get it. You can get a firearm on the street and not have it legally purchased. So
Yeah.
with that is how do we mitigate access and
Mhm.
possession of firearms?
Yeah, no, those are really helpful tips. I
Mhm.
appreciate that. Thank you. Thank you.
Yeah.
I don't see any raised hands or anything online. So, but please, if at any point you want to chime in, please do so. So then, like, again, like for anyone who's engaging in these conversations, and this may look different, I'm sure will look different when we're talking about a military or service personnel standpoint. But in general, for us, you know, when we're working with folks across the state, they're just things that we really try to encourage of our clinicians, you know, like really being mindful of your own biases, what you may be bringing into that conversation. We know that firearm ownership can be due to longstanding beliefs, values, different cultures. As I mentioned, hunting, shooting sports are two big ones, military folks. So people approach firearm ownership from lots of different perspectives. I think it's also really important to sympathize, you know, with what that means to somebody. Like letting go of their firearm might be something that is very weighty, very heavy in ways that it's important for us to be mindful of and to consider. I think clinically speaking, being mindful of the confidential nature of those conversations, unless of course we're talking about a situation where we're concerned for somebody being at risk to harm themselves or others. Um, and I think for a lot of these conversations, when you lead with, like, I ask all of my patients about this, if it's a universal safety thing, like, so that that patient doesn't feel singled out, like, hey, I'm going to ask you some questions about safety or some safety practices. Please know I talk with all my patients about this. It's not just you. If you don't want to answer any of these questions, that's okay with me. But I want to make sure, as somebody who cares about you, whose responsibility is to cover all these things with you, that I'm taking the time to do that. Can you tell me, you know, do you have firearms in your home? Tell me how they're stored. You know, I think having open-ended questions and conversations is always a great way to engage. We're going to go over a variety of different scripting examples. You can decide what works well for you. But I will say, frankly, even in some of the slides that you'll see here, I think there's opportunity for improvement. I don't like to be asking people, for example, are your firearms stored safely? Because honestly, my conception of what safe is could vary dramatically from what your conception of safe is. I don't think it's the best way to ask that question, because it almost seems like there's judgment embedded in it. And so asking in a more open-ended way can, I think, like lots of difficult conversations, open up space to have more meaningful dialogue as opposed to closing things down. And then I think just being really mindful that words matter. I think, you know, even Don had mentioned, I think in our last conversation about the lock it up or the negative connotations, my understanding of what you had shared was that for some folks, like using that term or using that phrase of locking it up can almost be like when you have suicide conversations and you use the word like commit suicide, where it seems like something negative, like something bad has happened. And I thought that was really illuminating. I hadn't heard that before. And I think this is kind of one of these areas where it's like you're always learning, you know. And I think when I first began this work at Children's, also we use safe all the time, safe storage. And it was only after having conversations with lots of other folks when it's like, don't say that, like that's really off-putting, because like secure is a more appropriate term to be using for A, B, and C reasons. So then trying to be more inclusive with how you even talk about safe and secure storage. And I think words do matter. And I think you know, it's an area, I think this is just the reality that we live in. I think it can sometimes feel like it's harder to kind of meet and have some conversation if you feel differently about something. And I think just acknowledging that, showing up with some curiosity, with openness, with receptiveness to differing ideas, and being mindful of the language that you use is just really important to keep in mind. Are there any other considerations that folks would like to add or think should be on this list, or things that you try to approach in your work?
I think for me, like I completely agree, words matter. And I also think taking a step further of identifying like what that's defined as.
Mm-hmm.
And here's an example. So when I did regulatory work, is my previous job before coming here, the word locked and secured, two different meanings, because locked means lock and key, that it is somebody is holding, you know, it's secured, but it's locked up with a actual lock of some sort, whether it's a magnet lock, a lock and key type thing, versus secured means I'm just putting it away. Like I'm removing it out of sight versus that lock, you know, having a locking device is involved. And so from a regulatory standpoint, that would be the argument when it came to chemicals, right? That was the biggest thing about toxic substances and chemicals, where the WAC said, for example, that it has to be secured. Unsafe items has to be secured. And it was in a closet, in a hallway thing, behind closed doors, without visible observation, but somebody got into it, and then the regulator is saying, well, it wasn't locked up. What's it defined as? So it goes back to the words matter, but then also identifying for specific things of what it is that we're, communicating the context of how we're defining it.
Yeah, that's
too,
important.
because with, Don's example too is it secured? Yeah, sure, but it's put away.
Right.
Versus locked up with one of these contraptions or some other, like a physical safe, etc.
Yeah, I appreciate that. Thank you. That's important. Anyone else have any context or questions or comments they want to add? Okay.
Yeah, we used to go to administrative hearings over civil fines and stuff over simple, but just words.
Ooh, I believe it. I believe, especially in a legal context. I think with this one here, this is really meant to provide additional framing for these conversations. Again, I think a lot of clinicians find it helpful to have these additional data points when you're going to be engaging in conversations. I think Don sort of mentioned this also with some of that scripting that he's talking about. These last two data points here, a study of adolescent suicides found that over half were carried out with firearms from the adolescent's home, coupled with more than 75% of the firearms used in suicide attempts and unintentional injuries were stored in the residence of the victim, a relative, or a friend. I will say very clearly, there are actually quite a few studies that pin this number closer to 90%. But the point is very much that we know, especially for young people, well over half, even close to 90% in some studies of those suicides that were completed with a firearm, those firearms were taken directly from that youth's home or from the home of a relative or a friend. So I think it also just really reinforces, to Don's point, the importance of thinking not just about your own home, but who might have access, where might that child be going, and having access to firearms in another home, for example, or thinking about other people coming into the same location or place that a firearm may be unsecured and accessible.
Well, it also makes me think of the legal ramifications of your firearm being used to commit a crime. So before I came here, I worked at the prosecutor's office and I worked in the juvenile department. And an individual who was the victim of a crime had his firearm stolen out of his vehicle by a youth.
Yeah.
And then that youth used that firearm to commit a crime. Well, then it turned to the prosecutor of, do we charge that individual for leaving that firearm unsecured by state law? Because it wasn't locked, it was sitting in a glove box, and that wasn't considered secured by the state RCW. And so it turned into a whole other case, but he was going to be held legally responsible for the use of that firearm in a crime, even though it was stolen from him.
Yeah, that is, I think, such a good point. This comes up and we don't point to, if you have a resource that helps to go over what the legal implications are or the expectations legally within the art. Yeah, I know the attorney general used to have a really good FAQ page that gets into a lot of what the legal implications are if you have a firearm that's unsecured that's later used in a crime. We don't lean into it so much clinically, but it's come up routinely, out in communities. So for those even online, know that that's something you will likely get a question about, because I definitely have. And I'm glad that you brought that up. Thank you, because I think that's an important piece to be mindful of.
Yeah, when I was talking to our partners, I think it's Seattle King County Health Department, who does the Lock It Up program for King County. They were saying a couple weeks ago that South King County has a high prevalence of gun violence and stolen firearms.
Oh, yeah.
Huge.
Yeah. Their data dashboard will go at the data scientists at Public Health Seattle and King County are phenomenal. And they developed a whole publicly facing data dashboard that looks at firearm injury related to theft. So kind of looking at stolen firearms, what our firearms have later been implicated in crimes, and it's compelling stuff. There are also whole separate conversations about 3D printed or ghost guns or things like that we won't have time to dive into today. But I think it's an area that increasingly, you might hear questions about these things. So if it's an area of interest that you want to dive into and learn more about, there are resources for that. But yeah, thank you. Super helpful. I will say this particular point is, can be very provocative. And I will say if I'm going to get strong opinions about any data point, like this would be it. And I will say that there are studies that have been replicated nationally. This here comes from a study that was actually conducted in King County, so here in Washington State, back in the late 80s, early 90s. It was published, replicated again in like around 2019, early 2020s, with sadly very similar data. There are absolutely limitations to this study. I want to be clear. I know, for example, some folks even at the sheriff's department were wanting everybody to be really clear that the limitations, like what about folks that might have been scared away, when trying to commit a crime, by the fact that you did have a firearm. And yes, that is a very valid point. I will also add, though, that we know pretty clearly that firearms in the home, and we're really thinking about firearms intended for self-protection, protection of your family, protection of your community, are indeed more likely to be involved in a fatal, unintentional shooting, homicide, or suicide than they are to be used in self-defense. The data are pretty clear on that, and I recognize that that doesn't sit well with folks always. So it's not necessarily a data point I lean into often, but it comes up, and I think it's important to be mindful of what we do know from some of the data that are out there. Any questions or thoughts on this one?
I would think that that's fairly accurately stated, because how many people of us are using firearms for self-defense? For me personally, I can't say for everybody.
Yeah.
That me using a firearm or ever having to use my firearm for self-defense is minimal compared to the occurrences that could have come from this, from unintentional shootings, homicides, or suicides.
Yes.
Yeah.
And I do think like it's one that gets a lot of pushback. And in the study, it says like more specifically 43 times more likely. So 43 times more likely, I think, in sensitivity to the unease that some folks had with that figure. We try to take that, the point in taking the 43 down was really like, listen, maybe 43 is like a sticking point, even though that's what it's cited as in the data here, in these studies right here that are cited. But really, we do know generally it is absolutely more likely to be involved in these types of events. But it's one of those data points that I recognize brings great unease for some. Any thoughts or?
So, and I always argue all different sides all the time.
Sure.
Because then I'm looking at it and I'm like, well, it's a good thing then I use a shotgun for home defense, because the shotgun is 6% was used as a firearm, right? Versus the 60-something% for a pistol. And so I can only imagine then running into people like, well, then I own a shotgun for home defense, so why do I need to worry about this?
Yeah. And I think if anything, it helps to bring about like robust dialogue. And I think there are also conversations that we will not have time to dive into today, but I think a lot of really important conversations about this desire for self-protection, or when you see this correlation or relationship with increasing firearm ownership, right? And like what's going on there, peeling away a little bit to understand. Okay. Well, if folks have more they want to add, please feel very welcome to do so. But otherwise, I will keep it going. So really, again, we're focusing now on some of the key messages that we have as part of that are really derived from the data that we just discussed. So we know that secure storage is effective. Practicing safe and secure firearm storage is an evidence-informed intervention to keep kids safe from suicide, violence, and unintentional shootings. That's a really simple key message to convey in a short clinical setting. So that is absolutely one that we lean into. In addition to this, hidden is not safe. I think this came up already in conversation, and we've covered some of this, but we know that teaching a child about firearms and telling them not to touch a firearm just isn't enough. Kids are naturally curious, and they will absolutely be tempted to play with a firearm if they encounter one. So again, a very safe or a very quick message to get across in a short clinical encounter. Hidden is not safe. We know that secure storage is effective. And then you have additional framing. And then I think clinically speaking, this is always going to be one of those spaces where, it requires us to just approach this leaning in with what we know to be the gold standard. So we know the most secure way to store firearms is to use something we refer to often as the triple safe method. So keeping your firearm unloaded, keeping that firearm locked up, and keeping the ammunition locked in a separate location. And then I think it's also important to be mindful of the firearm storage spectrum. I think for many clinicians, right, we have, I know this language is off-putting to some folks, but like something called harm reduction, right? Or something, even when you think about motivational interviewing or anticipatory guidance, what I may want for that patient, I may want so many things for that patient, right? And I think it's important for me to recognize that how I enter that interaction, it's not about me. It's really about my ability to provide the data in a thoughtful, respectful way that brings integrity, while also respecting what's best for that patient in their own view, right? What is feasible for them? What do they want? What are their goals? And so for a lot of folks, like triple safe storage is not doable. It's not what they want. It's not what they're going to do. And so really working with them to identify, well, keeping a loaded firearm completely unsecured in the home is definitely the least safe and secure. Might we work with one layer of safety or security? Could we perhaps keep that loaded firearm locked up so there's one layer of protection, or navigating what that could look like to move toward the direction of triple safe storage? But I think that nuance and appreciation for not everyone's going to need triple safe storage, for example, or their needs or desires are going to vary pretty dramatically, is important to be mindful of when talking or counseling patients. Do folks have thoughts, questions, pushback, or anything they feel they want to share about this? No? Pretty straightforward. Okay. Another key message, and I know we've touched on this, but really temporarily removing firearms from your home if a family member is depressed, suicidal, or is using drugs or alcohol could save their life. I think Don and Nicole have both provided really great information on thinking through temporary transfer of your firearm to a loved one or a friend who can take ownership while you're in that moment of crisis. Another resource to be mindful of is the Washington Firearm Safe Storage Map. Many states across our country have these. This is one that is maintained by the University of Washington Firearm Injury and Policy Research Program, aka FIPRIP. This, I know they have actively been working to update. Most of the different locations on here that you can identify by typing in your zip code are law enforcement agencies. I'm going to be clear about that, but they also have retailers, ranges, and other folks who have been willing to consider temporarily storing someone's firearm. Also, going to that website is really helpful because it has some of those questions to think about before showing up with the firearm at any of these locations. So calling to talk with somebody to understand, is there any cost associated with the storage? How long can you keep the firearm? What does the background check situation look like? Do you offer pickup services? Like all of those sorts of questions are listed on the website. And so this is a really nice resource to be aware of. In addition to that, as we have sort of mentioned, there are options for folks who maybe they want something bigger than a lockbox. Maybe they want a whole safe or a vault, or maybe they want something for a long gun or a jacket. I've never heard of the magazine ones that you mentioned, Dawn, but I'm curious to see what those look like.
The chamberlets?
Yeah, I'm curious.
Yeah, there's for shotgun and AR.
Yep.
I believe
Okay.
I could go grab one.
Yeah, no worries. I'm really curious to see what those look like. But this is a really great program to be aware of. I know that there are absolutely other health departments, and Thurston County absolutely has their own Lock It Up program.
They just had an event last month, I believe.
Awesome. Yeah. So like these are like part of public health work. Seattle and King County's work has really been to support other health jurisdictions throughout the state to build their own Lock It Up programs. Basically, what the Lock It Up program is it's a collaboration between public health and different retailers, firearm retailers. So you mention the program and you're able to get an additional 10 to 15% off of your firearm device. And it's, in Washington state, of course, as I'm sure you all are aware, there is no tax on firearm locking devices at baseline. So having like an additional 10 to 15% off can be very meaningful for people. So this is one option, if you want that additional discount on another type of locking device to be aware of. One other thing is we at Seattle Children's recently launched a PSA I'd encourage you all to watch it and let me know what you think. It's pretty short. It's only like 1 minute. People have had very interesting reactions to it. The demographic was really intended to meet the needs of firearm owning families or families that have multiple firearms. And so as part of this work that we did with the PSA, there's a code at Sportco or Outdoor Emporium that you can use, Safe Kids at checkout, that will also give you a discount if you want a different type of locking device. So please know that for folks that want something other than the trigger lock, lockbox, and cable locks that we distribute freely, these are other resources to be aware of. Do other folks, are they aware of other discounts or things that they'd want people to be aware of? Nope. Okay. Thank you. Seeing some shaking heads. Okay. So we'll keep on moving on in the interest of time here. I think it's also really helpful for us to really reinforce to pediatric providers in particular that it often comes up. Providers are hesitant to have these conversations or worried that maybe it'll land the wrong way, or that patients and their families don't turn to them for advice on these topics. But we know that just isn't true. We've seen in multiple studies where families often expect their pediatric provider to advise them about secure storage and to engage in these conversations in a thoughtful manner. So I don't want that to be a barrier to folks bringing this up with patients, because we know that is a desire that is there. There are some of these, next we're going to lean into some of the resources that are available for people. So I would encourage you, if you're really wanting additional scripting or examples of what that firearm conversation can look like, these next slides will give you examples of trusted resources to turn to. We don't have enough time to go through all of them in great detail, but of course the American Academy of Pediatrics, or the AAP, has excellent guidance for at least 3 different age groups that will give guidance or scripting for asking the youth directly if you're working with that adolescent, or for asking the parent or caregiver about firearms in their home. So this is an excellent resource to turn to. Bright Futures. In the toolkits, you have you have like those sections complete in their entirety right there for you to look through. Johns Hopkins, of course, the Center for Gun Violence Solutions, has their 5 A's. This program, often people will point out, like, why are there 5, 3, and 2? I didn't develop this, but they call it the 5 A's, and that's just what this is. So these are really straightforward. Are there guns in your home? What kind of guns? To whom do they belong? How are they stored? How is the ammunition stored? And then they have their advise. So like following that, what would you advise that patient on? And then assess, how can I help you store your guns safely? Are there barriers to safe and secure gun storage that I might not be aware of? Can I give you a free locking device? Gosh, we have 3 different models that we have here, and I'm happy to give you one. So that would be one resource. I think this New England Journal of Medicine article that came out about a year ago is truly one of the best I have seen when it comes to providing thoughtful guidance on having these conversations. I love this. I talk with all my patients about home safety. Things like water heaters, medicines. Tell me a little bit about what firearm safety looks like in your home. And then like good exploration questions. In a typical day, what does firearm storage look like for you? How do you lock the firearm up in that way? What firearms do you store this way? Like, I can barely read these. Tell me a little bit about the firearms that you don't lock up. I love this. And then when you do not lock up firearms, tell me a little bit about what's happening on those days. So I think like it really provides great scripting and guidance on how to open up the conversation for those situations where you might be missing something, or really trying to better understand the contextual factors around firearm storage for a patient. So this article would recommend, if it's of interest, to read through. CHOP, or Children's Hospital of Philadelphia, has a lot of EHR or electronic health record guidance for folks on documentation. Very straightforward and also super helpful for a lot of people. Is there ever a firearm in other places your child spends time, such as friends or relatives' homes? That's a really good one. Or thinking through Cincinnati Children's. I really like a lot of the scripting here. They've done a lot of work with actual virtual reality trainings for different clinicians, where they walk through full case scenarios where clinicians are then counseling in a VR setting. But I like a lot of their language. Like, I really appreciate how dedicated you are to keeping your child safe and thinking about these things with me. I know that these can be challenging conversations to have. Thank you for being willing to have them with me. And again, you'll have access to these slides.
This particular poster has been really popular for a lot of different groups where they alter it to meet their needs or customize it for different safety devices. But for a lot of our clinicians who approach this topic from a universal safety standpoint, this is wonderful. A lot of the medical assistants can have these conversations as patients wait to see their provider, where it's essentially, look, we have a variety of different safety devices in our clinic that we're happy to give you. They are free devices. Can you tell me, does your child have a properly fitting bike helmet? If not, would you like a free one? We can help you with the fitting as well. How about a life jacket? You know, we know that drowning prevention is something we care deeply about. Is your child in need of a properly fitting life jacket? And if so, would you like one that we can give you here free today? Are there firearms in your home? How are they stored? I ask because we have free devices that we're happy to give you that can help keep them secured and away from children to prevent homicide, suicide, or unintentional injury. So these are different resources that you have at your disposal. We use the safety checklist for home at a lot of community health events. And this is a really nice universal prevention checklist that folks use. Again, it kind of normalizes conversation for a lot of people because you're not just asking about firearm safety, you're asking about all these different things: burn safety, water safety, keeping children away from electrical cords or choking with firearms seamlessly infused in there. So something like this can be really helpful for some people. And then again, we know from studies that when you provide that education, it is most effective to be able to give that patient family a firearm locking device in the moment that you're having that conversation. That's really when you're going to see an increase in likelihood that it's going to be used properly and that it's going to be used at all. And so it's preferable to shipping it out to them later or mailing it to them. And of course, this is a quick glimpse into the demo kit that you all have like at your disposal. So this is what's included in there. You have the red mock firearm. I know a lot of folks do prefer that over the black one because it's very clearly a fake one as opposed to that black one, which is quite jarring. It looks very real. But you'll have your own lock, trigger lock, cable lock, and mock firearm to demonstrate with folks how to use. And then this is just a close-up look. I didn't bring a vault with me here today, but we do give out a small number of those as well. A lot of patient families that want to secure many things all at once use these. And then I think if we're able, I'm happy to share this video. I might need to just plug in my computer so it doesn't die though. So for this next video, y'all, this is like what we show for patient families. It's available in 5 different languages. Oh, thank you so much. I'm going to hit play and then we can watch this. You can get up and stretch while you watch this. If you want to take a bio break, I can give you the link and you can watch this later. You can feel free to make fun of me. It's really embarrassing being on these sorts of videos, but I hope I shared my audio. Let me know if you can't hear this. In which case. Yeah,
We're going to demonstrate safety devices for locking and storing firearms in your home to protect family members and children from injury. This will include a lockbox, a trigger lock, and a cable lock. Firearms are the leading cause of death in children and youth in the United States. Safe storage of firearms is one important step to protect people from injuries due to firearms, as it creates a barrier to firearm access to a serious child or someone experiencing thoughts of suicide or another crisis. We recommend using the triple safe storage method. This means storing firearms unloaded and locked up using a lockbox, trigger lock, safe, or another locking device with the ammunition locker. We use a fake firearm for education and demonstration. This is not real, but we'll handle it as if it were. Notice how I handle this by pointing it down and away from my foot and away from myself or anybody else. Always be aware of where it is pointing to maintain habits of safe handling. Even if you feel like you've taken out the magazine, always assume that there is a bullet available in the chamber. Now we'll demonstrate 3 different storage devices: a lockbox, trigger lock, and cable lock. There are multiple variations of lockboxes on the market, but they all have some common features, and we'll go through these to show you how to use it safely. This lockbox is designed to fit most handguns, including pistols and revolvers, or ammunition. The first thing to do when you receive your device is to set the combination on the dial lock. Combination locks are recommended because keys get lost and children and teens often know where keys are kept. Here's a combination that is not easily guessed by others. Most specifically, avoid combinations like 123, a street address, or birth dates. The goal when choosing a combination is to choose one that a teen or a child cannot easily guess, thereby getting into the device. Now, when you receive your new device, the first thing to do will be to set your new combination. You can do that by first looking here, and you'll note that the manufacturer has a preset of 000. Enter that in, and you'll be able to open up this device. When you have selected a new 3-digit code, you'll note here that there is a tab on the corner of this metal plate with an A and a B. Move this tab from the A position into the B position, enter in your newly selected 3-digit code, open this back up, and then put it back into the A position. And putting this metal tab into the A position is what secures that new code in place. You'll want to test out your new code to assure that it has been successfully coded prior to closing this box and locking it. And in order to do that, simply turn this knob over here into the lock position, enter in your new combination code, and turn this black dial to the right to ensure that it actually opens up. And then, when you open up your device, you're going to notice it has a lot of padding in here. We do recommend that you remove this top layer of padding so that you actually have room for your handgun to get in here, or the ammunition if that's what you're going to keep in. Additionally, having some or a single layer of padding will help to provide a little bit of stability or keep the handgun from getting too jostled around here. We also want to just encourage you to keep in mind triple safety. So when you are locking up your firearm, you're ensuring that it is unloaded and that you have ammunition stored separately. One final feature that we're going to go over with this lockbox is the cable that it comes with. Now, this cable can be used when transporting your device in your vehicle or as an additional layer of security within the household. You would use this by wrapping this around the foot of a heavy piece of furniture or an immovable object. Simply looping this through, you're going to notice then that it has this divots on the edge piece, which fits very securely into the side of the lockbox device. Securing that into place prior to closing this, closing that up, and then your device should be secure in place.
So I'm going to be demonstrating how to use a trigger lock. The trigger lock is mainly used for long guns and larger weapons. However, they also work on pistol type as well. But before I mess with the trigger lock, I want to ensure that I'm practicing safe weapon handling. That means keeping my muzzle pointed in a safe direction, keeping my finger off the trigger, and before handling the weapon, I want to ensure that it is unloaded and there's no bullets in the chamber. However, this is not a real firearm. When I pull it back, I can't see for sure. It is unloaded. I'll put my magazine up to the side. What you want to do, pull the lever up, and it'll come apart in 2 pieces. You're going to place this cylindrical portion right here behind the trigger. You don't want to put it in front because it has the potential to get pushed back, potentially cause an accidental discharge of the firearm. So what we're going to do, push that in the back. Practice motor control. Take the back plate and push it in. Pull the lever down. Squeeze it. Here's an audible click. From there, you can scramble the combination. You remember it. And your firearm is now safe. It's a common misconception with these that it takes a long time to get the lock undone. However, with practice and proper training, it should take no more than a few seconds. So my combination is 000. I'll put that in now. Lock. There we go. I'll place my firearm off to the side now. And I'll show you how to change the combination on this trigger lock. It's the black. Lock it. You want to make sure it's all together and lock it. For setting the combination, you want to make sure you're not 1, 2, 3 or 000. And do something that only you will remember and that a curious child or teenager won't guess. So for demonstration purposes, I'm going to do 117. So what you want to do is find this little reset key on the side. You need something like a pen, work this fine. You're going to apply constant pressure the entire time while setting the numbers. So 1. There gonna release. Now unlock. Put back on, now it's locked. Change your combination, pretty easy with these. I recommend taking a version that's combination lock and not a key, because keys can be locked. We want to make sure all our firearms are locked up, even if our children are properly trained. Because of this is curious kids can gain access to our firearms and make some life altering decisions.
Finally, I'll go over the basics of a cable lock. Cable locks can be used with handguns or long guns. You'll notice that this is a speed lock. Sometimes this might be the only option available or someone's preference, but there are combination of cable locks on the market. A cable lock may be used differently depending on the type of firearm that it's being applied on. Just always make sure that the ammunition is unloaded from the firearm before applying the cable lock. So to prep the firearm, I've removed the magazine. I'm going to put the slide in the lock position here and double checking that there isn't a bullet available in the chamber. And then I'm going to unlock the cable by turning the key, taking this out. We're going to put the cable and insert just through the ejection port and down through the magazine well. Then I can come through, insert the cable, turn the key, and now the firearm is secured. To unlock it, I will take the key, insert, unlock, take this out, and you are ready to go. Sometimes big firearm storage may not be enough. Temporarily removing firearms from your home if a family member is depressed, suicidal, or using drugs or alcohol to save their life. You can also ask family and friends to use safe storage steps if they don't firearms.
Okay, I know, kind of painful. It's helpful often to have what we're gonna.
I didn't say
You're
that.
still on probation.
Yeah.
Yeah.
I'm kidding.
That can be a really helpful video, even with its flaws, to share for families if they're not able to spend the time to get that education on how to set the combination lock at the time that you have your clinical meeting or encounter, or certainly at community health events where you're just distributing really broadly. Clearly would not meet the needs for all folks, but it's one resource that is available. Another resource that is available are the lockbox instructions and trigger lock instructions that you see here. Again, if folks would find it helpful, they can have the original templates for these and they can tweak it or alter it to meet their needs. A lot of different folks, including I think at Harborview, where they're now rolling out. We trained them, a year or so ago, and they're now in the process of initiating their own program. They really have used these, and they want ones for cable locks that we have not made yet, but so it can be helpful for some folks. We also have some community education specifically on firearms in the home. It provides some guidance for families on how to ask those questions about whether or not there are firearms present in the home of your child's friend if they're going over there to play or for a sleepover. And then additional information on teens, depression, and firearms. You'll have these in your lockbox. And then for some additional resources for y'all to be aware of, this is an excellent resource out of Johns Hopkins, which really helps to provide some scripting and information on asking the parents of your children's friends whether or not there are guns in the home. Take what works well for you and then leave the rest, of course. This is a charting example for some people that are really in the process of building like an epic section, if you will, on access to firearms. That can look lots of different ways. I also know that EHR builds are very expensive, very costly, but this is like one option of, this basically triggers a much more in-depth assessment tool within the electronic health record on asking about firearms. And a lot of this information is pulled for reporting purposes, for quality improvement, to find out were these questions asked, or if somebody said yes, was that clinician following through to provide the safety device? Because then you're able to drill down into why or why not that didn't happen, did or did not happen. Additionally, these are a couple of the publicly facing data dashboards that were mentioned. The Department of Commerce Office of Firearm Safety and Violence Prevention has a really fantastic in the sense that it's rich with really helpful data, publicly facing data dashboard for folks who want to better understand some of the circumstances that surrounded the suicide. You can look at suicide firearm related deaths, and you can break it down by population, by race, ethnicity, I believe, in addition to the ages, to help you better understand what this looks like in certain regions throughout the state and statewide. This is the Public Health Seattle and King County dashboard on theft. They utilize a lot of the data that's pulled from the Association of Sheriffs and Police Chiefs, taking that data to then develop a dashboard that illuminates what this could look like. So if for those that have interest, you're welcome to jump on their site and take a peek. This is the Counseling on Access to Lethal Means, or CALM program, that all of the clinicians at Seattle Children's undertake who are going to be engaging in these conversations. It's free, it's online, it's self-paced. I think it's very well done. So if anyone is looking for more education around lethal means counseling, this is an excellent and respected resource to look to. Harvard also, of course, has their Means Matter programming online. That's quite good as well. For people that are really interested in more of the clinical application, Bullet Points has been around and doing this work for a long time. They're out of UC Davis. They have their 3 A's framework on approach, assess, and act. They also, I will note, have some webinars and recorded sessions that are more applicable for military service personnel. So look to the Bullet Points project, how to counsel, for some of their resources if you're looking for more information. For people that want more messaging guidance or implementation guidance, these are all excellent resources. The Joyce Foundation has recorded webinars that are excellent that you can watch freely. So does the Children's Hospital Association has a whole series on firearm injury prevention that they've recently released. In addition to that, ERPOs, I would point your attention to the King County site, which is excellent. I know the Alliance for Gun Responsibility has also been under I don't think it's launched yet. I don't know, Nicole and Don, tell me if I'm wrong, but I think it's still in the works, but they're creating a whole website specifically designed to assist with ERPOs and provide guidance on those. But a couple additional resources that you can look to. And that is basically it, y'all. You will have your demo kits. Like, if anybody wants to practice with any of these, I'm happy to stick around for that. I'm very curious if folks have more questions. Please let me know. And then please, I want you to feel very invited to provide feedback, again, even if it's critical. It's helpful information for us to be aware of so that we can make the trainings better or more applicable to folks. So thank you so much for your attention. If you have questions, I'm all ears.
Quiet group today.
Yeah, what's this all? They're like, they've been lulled to sleep by all this information.
That was great information, and stuff that we could use for your briefings. I mean, not that they're not great, but education that we can do even as part of the governor's challenge
Well, and
work.
the timing works too, because for the SRU's open house event, they want a longer version of that training. And I was really dreading making it longer because it's only 15 minutes. And I was like, I don't want to make it longer. But now I don't have to, because.
Yeah, you're welcome to use any bits that are helpful. 100%. Yeah, I'll give you a copy of the updated slides. Yes, thank you, Holly. I see your comment there. Thank you so much for being here and for sharing.
The demonstration video, even though, whenever we have to do videos with ourselves in it, it's always awkward. But I think it's definitely a good tool, because we give them out all the time. I'm like, do you know how to use this before I give it to them? I feel like the lockbox is pretty self-explanatory, but with trigger locks and cable locks, people don't always know. So.
Mm-hmm. Yeah, that's good. And there's actually here, if you don't mind my standing up for a second, in this demo kit, we have found this super helpful for community events in particular. For some people that don't want to take all the education materials with them, you should have it in here. This firearm safety resources has QR codes to everything, like including the videos.
Oh, perfect.
So whipping up something like this can be really helpful, because then people could just like scan the code and they can have it for later, or take this page if they don't want to have all these open tabs. And I will send you an updated firearm storage device, like this toolkit. We just have these like little guys left because they're all gone, but we're in the process of revising for the next biennium. So you have your own copies in here to keep. Yeah.
Yeah, when Don and I went to Texas for the conference, the VA came out, they had launched it. It's probably around this size. It's a pad that has how to use the cable lock. So it's step by step, the visual, somebody sitting down. And so it was a nice tool that the VA gave out. We were able to get some before Rachel left.
Oh,
per
yeah.
position.
Yeah.
Yeah.
Mhm.
But it's nice because, it's again, brown this size.
Mhm.
And then it has all the instructions that because people see
It's
them and they're
helpful.
like, cool, what's this?
What do you do? How do you use it?
Right. And you're like, is this a bike lock?
Mhm.
And it was interesting because I was at an event last week and the person that was doing the table was a veteran.
Mhm.
And the person's like, well, what is this? They had him there and he's like,
Mhm.
oh, it's a gun lock.
Right.
And, so the guy was like, well, how do you use this?
Mhm.
And he couldn't say what it was.
Oh, interesting. Yeah, that's good.
And he goes,
feedback.
I don't know, some people use them for their bikes and but it was interesting that
Mhm.
another, a veteran who's trained could not
Yeah.
give directions on how to use
We're not giving
it.
those in the Army.
Oh, no, right.
We get an
Yeah.
arms room that we put them in, and then somebody else locks it up for us.
Well, I think
That's so
at one
interesting.
point saying that is that we should not assume that just because somebody is trained,
Mhm.
perfect,
That's an old
in,
one.
and trained in firearms, that they know how to use every single
Yes.
locking device. out
Totally.
there. That was.
Well, and there's also the myth that using that kind of device damages the firearm, right? Because keeping the pistol locked to
Yes.
the rear, that can damage the
Mhm.
spring, but that's a myth,
Mhm.
unless it's a very old firearm.
Oh, interesting.
Yep.
I'm curious if you heard what I have heard from some people with these, a couple points that we didn't touch on this, but I have heard feedback from, actually this is, just north of you in Pierce County at an event. There were some folks that were saying that the combination, we often will recommend that families use combination. It's just a little bit more secure especially for kids who almost always know where keys are hidden, even if their parents don't think they do. But there was a really interesting point made at this at the community health event where they were saying, like, for a lot of folks in the house or for some people, this might be too hard. Like if they have issues with arthritis or maybe like other problems going on, that using the combination, or visual issues, that where a key might be preferred for those populations. I thought that was really helpful. I'd never heard that before. And then I have also heard, so we got these combination ones to have a combination cable lock option, but I've heard from some people that they don't want this metal in their firearm, that it could, like, they're worried that it might scratch something on the inside. Like, have you heard that before, or has that been?
Well, and that's why a lot of
That's
them
why
have
these
that.
have the coating on them.
Yes,
Yeah,
okay.
so they don't damage it. But, hey, Dave, do you mind, I don't mean to put you on the spot, do you mind sharing your story about the trigger lock? Yeah. Dave's there.
Dave's not here, man.
Dave's not here.
Dave's not here, man.
Okay, well, he had his wonderful story that he shared with the governor's challenge. Oh, there he is. Okay.
Hey, sorry about that. Yeah, so
All
you're at,
good.
you talking about the fiasco I had?
Yeah, well,
Yeah.
it's a success story.
Yeah, right. So I was using the trigger lock, and what ended up happening so once a year I host a camp and shoot event here on Whidbey Island, for veterans, and so I bring some of my firearms out. But I had some trigger locks on my shotgun and my AR, and I was getting ready to get everything set up, and a couple of veterans wanted to use my things. And so I went to go and put what I thought the code was in on the firearm and forgot what the damn code was.
Oh,
Took me
no.
freaking several hours to try and figure out how to get it off. I ended up having to use a girl from the 4-H that was 16 years old to figure out how to break into my rifle. And so, yeah, so they work as long as you remember the freaking code. But my dumb ass forgot my code, so it wasn't beneficial at all.
Right?
I love that one of the 4-H kids jumps in to oh my
Break into
God.
it, right?
Yes. This actually reminds me, this was, I think, out at a training in Mason County. I don't think they'll mind my saying this, but there were some sheriff's deputies present for this training. And one of them was really focused on all these TikTok videos or other things about how to break into these different devices. And there was like one person in particular, like some sort of a lock breaker or something like that. And he was bringing up all these videos. I was like, whoa. I will note, this is just an aside, they tried one of the tricks on the box and it did not work. But it does, I'm sure, if you're quite persistent.
Yeah.
But I think, like, if those questions do come up clinically, I think one one way to just have a thoughtful conversation around that too is, again, like acknowledging that nothing is going to be foolproof or 100%.
Mhm.
Really, it's about, again, that time and space, right? Time and space. Like it's going to be harder to get into it. It doesn't mean it's completely foolproof, but anyway, I say that just because it's funny that I'm thinking of the high school students where the sheriff was specifically like, you even know what the kids are watching these days. I was like, well, maybe in this instance it was helpful. Thank you for sharing. Well, thank you so much, everyone. I so appreciate you. Thank you for all the work that you were doing. If there's ever any way that we can be helpful at Children's on our team, please do not hesitate to reach out or let me know. I hope that you're able to enjoy the sunshine for a little bit today, and hopefully I'll see you all at some point in the not so distant future.